DLK is an early postoperative complication which appears as an inflammatory response initially in the corneal stroma, followed by the flap interface. There are a few stages of DLK. Stage 1, defined with the presence of white granular cells in the periphery. Visual axis is not involved. It's most common at day 1 and may be present as 1 in 25 or 50 cases. Stage 2 DLK, characterized with the presence of white granular cells in the center of the flap. Visual axis is involved, most common at day 2 or 3. It has a shifting sad appearance and appears 1 in 200 cases. Stage 2 DLK, here we can see a clinical case. The case is characterized by white cells in the stroma that now extend to the center of the cornea. There is no clumping of cells in the interface of the cornea. Stage 3, characterized with the aggregation of more dense white clumped cells in the center. Visual axis is involved, periphery is usually relatively clear, and it's associated with a subtle decline in visual acuity by 1 or 2 lines. Stage 3 might appear 1 in 500 cases. Here we can see a clinical case of stage 3 DLK. It's characterized by fine white cells that have now clumped slightly centrally or just inferior to the center of the cornea. They are no longer only in the stroma but have now layered slightly in the LASIK interface. At this stage, they may actually start to clear in the periphery, and this is the most important stage of DLK to recognize. The management in this case includes a lifting of the LASIK flap and gentle irrigation with antibiotic or corticosteroids. Stage 4, it says severe keratitis with stromal melting, scarring, and associated visual morbidity. Here we might also observe hyperopic shift. Periphery of the cornea is relatively clear and it appears 1 in 500 cases. As a summary, postoperative examination at day 1 after LASIK procedure is extremely important to diagnose this kind of inflammatory process. Careful cleaning techniques may reduce outbreaks. Treatment of stage 1 and 2 includes aggressive topical steroids and careful daily monitoring. Treatment of stage 3 includes lifting the flap, gentle rinsing, and careful daily monitoring thereafter.